Hi, I am Dr. Chandrashekar, Head of Orthopedics, Chief of Knee Services, Sakra Hospital. I am here to talk you on knee replacement surgeries. Knee replacement surgeries are commonly performed surgeries across the globe. These replacement surgeries are performed for patients suffering from osteoarthritis or wear and tear of the knee. Depending on the wear and tear of the cartilage, we divide the arthritis into grade 1, grade 2, grade 3, grade 4. Not all arthritis requires surgery. Grade 1 arthritis are less than 25% of wear and tear, and grade 2 arthritis less than 50% of the wear and tear of the knee joint doesn't require replacement surgeries. Usually they are treated with rehab, lifestyle modification or some lubrication injection inside the knee. Surgeries are contemplated for painful grade 3 and grade 4 surgeries. In grade 3 surgeries, we try to conserve the knee by doing partial replacement or only one compartment of the knee replacement is done, or we do a procedure called osteotomy, which increases the space inside the knee. Grade 4 arthritis, always we choose for knee replacement, and it's the gold standard for the treatment. The knee replacement can be performed in two ways, conventional ways and use of techniques called computer assisted technology. Over last 5 to 6 years, I am performing this computer navigated knee replacement surgeries. Previous to that, I was performing conventional knee replacement. I have found that these computer assisted knee replacement surgeries are beneficial in the terms of short, small incision, less blood loss, more accurate, better ligament balancing, and also because the jigs used are very small, the soft tissue retraction is less, so post-operative rehabilitation is faster. Using this computer navigation technology, I have done knee replacement post-angioplasty, both knees together, post-cardiac or coronary bypass surgeries on both the knees together, and I have also performed surgeries on patients with pacemaker. I have done both the knee replacement together. This is the normal knee with thigh bone, leg bone and kneecap bone, and this is the replaced knee. The replaced knee has three components: thigh bone component, leg bone component, and there is a plastic in between. So these components constitute a total knee replacement implant. Once we do the surgery, the patient starts mobilizing the next day after surgery with the walker. Before they go home, about 50% of the pain will be relieved. After 2 weeks after surgery, patient will be walking with the stick. By the end of 3 weeks or 3.5 weeks, they will be walking independently without stick. Once they are discharged, our rehab team goes home, does the physiotherapy, which will be completely monitored by me, and also if anything is going away from the normalcy, I call the patient and tell them you need to really back up the exercises. Having performed more than 10,000 surgeries in Sakra Hospital and more than 3,500 knee replacement surgeries, I believe rehab is an important part of any surgical procedures for orthopedics.